Good morning. It's Wednesday, September 2nd, and I'm Dan McKee, President and CEO of Grace Inspired Ministries. Thank you for checking in, and thank you for your patience as we enter the final stages of our reopening process. We will continue to consult with our Residents Council, Resident Association, our department heads, our line staff, and the Bucks County Department of Health as we continue to evaluate the activities and services that we can safely provide for our residents. In reviewing the recent changes, I'll start by reporting that we have had no new cases on either campus since our last update. Testing results are posted on our websites. The timetable is set for skilled nursing visitation to resume. We will encourage outside visitation when possible, and will provide a room in the building when weather conditions dictate. It is still important to note that all visitors need to report to the main entrance at each campus. That's 12 Lutheran Home Drive for Lutheran Community at Telford and 3250 State Road for the community at Rock Hill in order to go through the screening process. Visitors will be required to wear a mask and maintain a social distance of 6 feet or more during all visits. Details on our skilled nursing and personal care reopening plans can be found on our websites. And for our residential visitors, after going through the screening process, you can proceed to the resident's apartment building or cottage where the resident will meet you. Please limit your time in the common areas of our buildings. Baseline testing has been completed for both campuses. The latest guidance from the Centers for Medicaid and Medicare Services, CMS, with their final interim rule that was published August 25th, requires that we test all skilled nursing staff members and residents if there's an outbreak. And an outbreak is defined as a new COVID-19 infection in any healthcare worker or resident. While we continue to be required to test any resident or staff member who presents signs or symptoms of COVID-19, this rule requires the following testing periodically. We must test all staff members who work in the health center monthly while the county positivity rate remains under 5%. We would need to test weekly if the positivity rate was greater than 5% but less than 10%. And we would need to test 2 times a week if the positivity rate exceeds 10%. The positivity percentage is calculated by dividing the number of positive tests by the total number of tests in any given week. So for the week ended August 19th, the positivity rate in Bucks County was 2.9%, so below that 5% threshold. And just to give you an idea, comparison-wise, Montgomery County was at 3.3% for the same time period. Philadelphia was 4%, and Delaware County was 4.6%. In order to help with the increased testing requirements, we have ordered a testing machine that we'll maintain on site, and we expect that machine to be delivered sometime in late November. We'll continue to work with our local labs to expedite testing over the coming months. Please continue to monitor the quarantine list for the state of Pennsylvania for any of our residents who are traveling. There are currently 18 states in which the Pennsylvania Department of Health recommends a 14-day quarantine for any resident who visits that state. And that list can be found on their website, which is www.health.pa.gov. As we prepare for potentially some increase in cases of COVID-19 in the fall, please continue to keep your guard up, wear your mask, social distance, limit your social circle, take advantages of things like curbside pickup, and continue the good hand washing. Keep some hand sanitizer with you. Use some of the many hand sanitization stations that we've installed throughout our campuses. And please continue to monitor yourself for symptoms of the virus and alert your primary care physician if you feel ill or start to develop any symptoms for the virus. And finally, please continue to check our website for the latest COVID-19 related information. Thank you for tuning in for our update.